So good morning, everybody. I'm really delighted to be here. Quite exciting that this very first hybrid event is actually on my home turf in Cardiff. So that's great. And hello to everybody watching in Cardiff live and online, and of course everybody else around the country and globally as well, as we heard. What Joe and I wanted to do today, Sue asked us to talk about the emotional well-being of midwives again, and we thought we would reflect on this study, the WHELM study, which was carried out in 2017, the initial data collection. Just give a brief overview of that study, but particularly focus on the paper that Joe led on, which was looking at the emotional well-being of newly qualified midwives. So that's going to be the main focus of the paper. But we also want to think about where are we now in relation to all of this, particularly in relation to COVID, and what are the implications and what can be done about some of the challenges that we've identified. So why does it matter? Why does the emotional well-being of midwives matter? I think Molly was referring to things being seen as the kind of fluffy side of work. And sometimes I feel the emotional well-being of midwives is seen as that, whereas actually to me, and this is something I've been studying really for about 25 years now, it's absolutely critical. It's absolutely critical that for the well-being, the physical and mental well-being of midwives, for their physical and mental health, it also means that midwives will stay in the job and they will thrive in the job. They'll not just hang on by the skin of their teeth. It'll actually mean that we attract people to midwifery and then we keep them in a job that they love. But we know that there's been a long-standing and growing staffing crisis in midwifery. I don't need to tell all of you in the audience that we've got persistent staffing shortages in the UK in terms of midwifery. It's estimated currently at 3,500 full-time midwives. And we have poor retention rates. There's a lot of competition to get a place to train to be a midwife. There's some dropout within the course, but it's particularly in that period of time following qualification where we lose midwives. And the estimate is that for every 30 new student midwives that start on the course, the net result in the workforce is only just over one midwife, which is pretty appalling kind of the maths of that does not look good, does it? And then, of course, we've got an ageing workforce and we're losing the skills of midwives in their 50s and 60s. Their skills and their experience and their confidence is being lost as they retire. And so all of this is going to impact on midwives' physical and mental well-being, and then ultimately on the quality of care that women and their babies receive. So next slide, please, Joe. So the UK WHELM study, just to remind those of you that maybe don't know about it or that maybe read it a long while ago, this was a study that was commissioned by the RCM, and we contacted all the members of the RCM in May 2017, and they were invited to take part in an online survey, which used validated tools to look at stress, burnout, and depression and anxiety, and also intention to leave. So they were all validated tools, and then we also asked some open questions about, which Joe will talk about. So just under 2,000 respondents to the study, and that represented 16% of the RCM membership. And this was qualified midwives. We decided we wanted to focus on what it was like when you were a qualified midwife rather than a student. It was a joint study with Griffith University in Brisbane in Australia, and they designed the original study, and they now have what's called the WHELM Collaborative, where the WHELM study is being carried out, I think, in about a dozen countries worldwide now. So it's quite exciting because we can compare country with other countries. So the study findings were not good. They were really worrying. What we found was that of the midwives who responded, 83% were experiencing significant levels of personal burnout. And this is on a validated scale for burnout. Over a third were suffering from moderate to high levels of stress and anxiety and depression. And 2/3 were actually seriously considering leaving the profession in the last 6 months. And when we compared this with other countries who had participated in this WHELM collaborative, these numbers in the UK were significantly higher than in other countries, which makes it even more worrying. And we found that adverse psychological effects were even more common in midwives who were younger and more recently qualified. And of course, those things often go together. And midwives who self-reported having some kind of disability. However, it's not all bad news. I'm always worried when I'm presenting this. It must make most midwives just feel like throwing in the towel. Because what we could see was actually that midwives' mental health is supported by good relationships with their colleagues, good teamwork. There's some lovely quotes about that, which Jo is going to share. When midwives were able to give high quality care to women, that was so important to them. And also there's something very fundamental there about the work that midwives do, which Molly has illustrated so beautifully. And this midwives' love of their work, these are all really positive things, which midwives drew on when they'd had a tough day at work. And there's a nice quote here, I think, from the paper that we wrote, which we'll give you a link to later on in the presentation, because we said that we were really concerned that younger midwives, aged 40 years and under, and those with fewer years of clinical experience, are actually at increased risk of emotional compromise than their peers, because, of course, these midwives are the future of the profession. And these are the midwives that we need to look after all midwives, but we must particularly think about the emotional well-being of this group. So that neatly leads me on to Jo's section. So I'm very pleased to introduce Jo.
Thank you very much, Billie. So as Billie mentioned, the original WHELM study in the UK found that poor mental health was more prevalent in younger participants and those with fewer years of clinical experience. And that finding was also similar in Australia, Norway, and Sweden, in the different arms of the WHELM collaborative. So there was definitely a rational reason to look at this group of midwives. But the real reason was I was an early career midwife, nearly 40. I was 37, 38 at the time. So I had a huge personal interest in this group. So just to share briefly how I got involved in the study. So in 2018, I'd been qualified for just over a year and I wanted to do my master's. And I became aware of the National Institute for Health Research pre-doctoral fellowships, which fund master's level study and support you to do your PhD. And one of the things I was really interested in was staff wellbeing. So I asked Billie to support my fellowship application, which she very kindly did. And I was awarded the fellowship. And when I began the fellowship, we talked about what I could get involved in. So at this point, the WHELM UK study had been done. It had been written up and published in the UK. But Billie was aware that she'd wanted to do more with the data, but she'd run out of time, essentially. So we got permission from the RCM for me to look through the data. And the free text responses from the early career midwives really struck me, as I said, being in that position myself. So at that point, I was just about to finish my preceptorship. So what we decided to do was a qualitative study looking at the free text responses from midwives who'd been qualified for 5 years or less. And I think my experience as a preceptor, I found it very much like having my first baby, right? Really, really difficult, but everyone else seems to be completely sailing through. And I very much felt like the other newly qualified midwives at work were enjoying it and doing well. And that isn't really how I felt. I found it very tough. So it was really illuminating, to see there were 620 early career midwives that responded to the WHELM study to have access almost to their diaries. It was really fascinating. And I started to see the situations that I was in at work as part of something bigger. So the study was a really incredible opportunity for me. There was no pressure. I was just having a go. Of course, you can imagine I got incredible support from Billie. And there were 3 other authors, Josie Henley from Cardiff and Jennifer Fennick and Mary Sidebotham from Australia. So I got to work on a collaborative project. I got experience with publication. And even though my PhD topic has turned out a little bit different, I think this experience helped my application. So coming back to this study, so as I said, 620 early career midwives were involved, and this was responses to the question of what are your top 5 factors that give you satisfaction at work and that give you dissatisfaction at work. So the 4 themes that we found were, firstly, midwives were under immense pressure, but regardless of this, many of them took a great deal of pleasure in their jobs. Relationship with their colleagues were really important. So where those relationships were positive, they buffered against stress, but where they were negative, they compounded it. And support in the role was absolutely critical. Midwives wanted to be treated as individuals. They wanted control over their shift patterns and their areas of work. So the first pressure was work stress. So almost every respondent spoke about the pressure they were under caused by staff shortages, by heavy workloads, or both. They often spent their time away from work worried that they'd made a mistake or they'd missed something because of the pressure they were under. Many of them said that they were exhausted and it had impacted on their mental health. And they felt a constant pressure to hurry, hurry, hurry. So in the community, midwives were talking about overbooked clinics with 80 to 100 women to be seen. In the labour ward and birth centre, they were going from one birth to the next without finishing their paperwork or handing over properly. And on the postnatal and antenatal ward, they often had safety concerns because of staffing shortages. So really, midwives talking about very difficult working conditions, an unmanageable workload, which meant that they had to do overtime unpaid just to do their work, just to get their work finished. They often didn't get breaks, including toilet breaks. And some midwives in particular reported really harsh working conditions. So they didn't have a staff room in some cases. They weren't allowed to drink while on shift. But if you're not getting a break, obviously that's a significant issue. And some midwives were told they weren't allowed to sleep during their night shift breaks, which I found really interesting because the British Medical Association advises doctors to sleep on their breaks during night shift and says that employers should provide facilities for this. And I thought that was a real contrast there. And midwives felt a strong sense of letting women down. So like in this quote, the feeling of failure when you physically exhausted yourself and couldn't possibly do any more is demoralizing. Above everything, not giving women the babies and care they deserve is the worst aspect. So many midwives felt they had to become task-centred rather than women-centred. And one midwife reflected the views of many when she said, I've got not enough time to deliver good care. I can just about manage safe care. But many midwives didn't feel that they were able to give safe care. So respondents regularly said they were unable to give one-to-one care in labour, and there were unsafe staff to women ratios in the antenatal and postnatal wards, and they felt that often managers were reluctant to close maternity units when the staffing was unsafe. So this respondent described the huge responsibilities and fear of making a mistake when the workload is too much. And some of the things that respondents mentioned were really clearly dangerous. So, for example, being responsible to care for up to 12 women on postnatal ward, or 12 women and babies on postnatal ward, 12 women in antenatal ward, or being in charge of an antenatal or postnatal ward when you've only been qualified for 6 months. So the second finding that we had was role satisfaction. So even though their work was challenging, many midwives took great pleasure in their work, and they felt it was a source of pride and self-esteem. One midwife said she felt a source of satisfaction was the simple enjoyment and love of the job. And midwives who worked in continuity of care models found this to be a particular source of satisfaction. Midwives were trying to give high quality care even though they were under pressure. So midwives in midwife-led units and obstetric units really enjoyed facilitating normal birth. They valued positive feedback from women and their families. They liked working autonomously. As early career midwives, they often spoke about gaining satisfaction from developing their skills, their knowledge, their confidence. And one finding which was really lovely was even though these midwives had been qualified relatively recently, lots of them were in senior positions and were talking about the satisfaction they got from supporting others. And when midwives gave high quality care, they felt fulfilled at being able to be the midwife they wanted to be. So our third theme identified was interpersonal factors. So working in a strong team protected against the stress of the workload. And many midwives spoke about dear friends that they'd made at work and how this made a really positive difference to their enjoyment of work. So they still felt the strain of working in an overstretched service, but those positive relationships and that good team spirit boosted their morale. And there's a lovely quote here: the awesome sense of humour and teamwork, even in the hardest clinical situations when our backs are against the wall. Clinical staff of all bands seem to pull it out of the bag, which is probably why the NHS hasn't collapsed yet. Credit to them all. We can see, isn't that gorgeous, the real camaraderie and support in some teams. But unfortunately, relationships with colleagues were also cited as a key source of dissatisfaction. So they were a very important factor in how people felt about their work. So this midwife described feeling too intimidated to ask for help due to attempts to humiliate myself and other newly qualified staff in front of colleagues by senior members of staff. And we noted a lot of division between staff groups, so between obstetric staff and midwifery staff, midwives in the community and in hospital and labour wards and birth centres. And one response, which I thought was really perceptive, a midwife said that you often get poor working relationships where people and resources are under pressure. And the final theme we identified was role support, so personalised and compassionate support for midwives, not only the women that we care for. And we were surprised how strongly this came through as a theme. Rota issues had a huge impact on the well-being of midwives. So they spoke about lack of control of their working hours and how that affected their friendships, their family life, their ability to do regular hobbies. And of course, those things are sources of well-being. Midwives spoke about the importance of having enough time when moving between day shift or between shifts, and in particular moving from night shifts to day shifts, time to really recover. And short notice of the off duty was something midwives felt very resentful of in particular. An interesting finding here was there wasn't one working pattern which suited every midwife. So some midwives wanted to do long shifts, some wanted to do short shifts, and some midwives said they were working too many nights and weekends, and others wanted to do only nights and weekends and were told that they couldn't by their managers. But these issues were really important, and in fact, several respondents had either gone part-time or actually left their permanent role because of rota issues. So their rationale was, I can work bank instead and I've got much more control over my working hours. So that was such an important factor. And midwives who could choose their shifts and their working patterns felt that that was a source of satisfaction to them. Thank you. So just to discuss the findings really briefly, they were consistent with other studies of staff wellbeing, and we already know there's a well-documented link between unmanageable workload, poor working culture, and poor safety and outcomes, because both the Francis and Kirkup reports highlighted those issues. Billie, I'll hand back to you.
Thank you. So just very briefly now, just to think about, well, where are we now, particularly in the shadow of COVID? Because I think COVID-19 pandemic has really highlighted the importance of midwives' emotional well-being, and actually the emotional well-being of all NHS staff is now being discussed at governmental level, and at last it's received public attention. To me, it's a great pity that it took a global pandemic for this to happen, but at least it's happening. And just to say that COVID, I think, produced, I worked with a group of UK midwifery professors, and we looked at the particular, one of the papers that we did, they were clinical briefings for RCM, and they're on the website, RCM website, but we noted key emotional challenges that the pandemic had presented. And these included the moral distress experienced by midwives. You know, if you think back to March 2020, I mean, we really didn't know what COVID was going to mean for us all. And frontline staff were very concerned for their own personal safety and the safety of their families. And of course, they wanted to carry on giving good care to women and their babies, but also there was that moral distress from also needing to look after yourself and your own family. There was high levels of uncertainty, working conditions were changing rapidly, new ways of working, protocols, and there was frustration and anger at lack of resources, and a real sense of powerlessness and exhaustion is what we were picking up anecdotally and from looking at the research that was beginning to emerge. You know, family life was difficult to manage for us all. Just how were you going to do the shopping, look after the children, care for elders, but even more so when you were on the front line. and being concerned for your own safety and well-being, particularly for staff who may have been more at risk of or becoming catching COVID or becoming seriously ill. So, for example, BAME staff, pregnant staff, staff with existing health conditions, and the support that Jo has talked about so well in the study of the newly qualified midwives. I mean, there was a real impact, wasn't there, on, because of social distancing and physical distancing, on the support we could offer each other. So what can we do right now? We thought we wanted to finish on an upbeat note, really. So what can we do right now to improve midwives' emotional well-being? Because it's so essential that we take positive action on this. And there are some great initiatives going forward. In Wales, I know there's a really interesting and exciting new preceptorship scheme, which has been prompted by this, by the needs of these newly qualified midwives that Jo has highlighted. It's been initiated by RCM Wales, and some of you in the audience will know about it, but just some key features. I've just got some notes here. It's informed by a compassionate leadership approach and the new NMC standards, and some features include all newly qualified midwives having an allocated preceptor, 2 weeks supernumerary status, having an ID badge which identifies that you are newly qualified, and regular wellbeing sessions and access to peer support networks. So of course that's for the newly qualified midwives, but for all midwives it's essential that we must improve and create a really positive working environment. There really does need to be even the basic things like staff rooms where staff can get together and give each other that support. So there needs to be real effort and creativity going into how to improve working conditions. Attentions to models of care and ways of working. If we look at the WHELM study, we've got a lot of evidence there about what gives midwives job satisfaction. Midwives really want to give that good quality of care to women. That's one of the key features in what gets them going to work every day. So we need to really think about how we can create working environments that enable midwives to give the care that they've been trained to give. Rota seems to be a really important issue, one that I personally haven't quite thought about enough. The importance of having plenty of notice for rotas and shifts, and accommodating preference for shift type seems absolutely essential. And it's a very simple way to make midwives feel that they are being valued and respected in the workplace. So on to our final slide. I think Jo just had a few thoughts here.
Thank you. So I think, as Billie said at the start, when we see studies like this, we can feel really powerless, can't we? It seems so big, difficult for us to challenge as individuals. But many of the factors that early career midwives said that they really appreciated at work and significantly improved their satisfaction are in our control, and they're not high cost. So a positive working culture, how we behave on shift really matters to the people that we're on shift with. Getting the rota out in plenty of time, as Billie said, making efforts to give midwives choice over their working patterns. We don't believe that poor retention is inevitable, and we think we can all play a part in supporting early career midwives in this time in their career.
Thank you, Jo. And for me, looking back on the WHELM study, kind of pre and kind of post, or in the middle of COVID, wherever we are at the moment. To me, I think it was so important because it really called out the emotional distress of many midwives, particularly the newly qualified midwives. And it raised the alarm that the country is in danger of losing those very midwives that it's only recently invested in educating unless something is done. And of course, COVID has only exacerbated all of that. And it also reveals, I think, how the poor emotional well-being of midwives runs the risk of poor quality and unsafe care for women. But I think the thing that comes out from the study and both these papers is that many of the challenges that midwives face actually are fixable, or they're at least modifiable. And there are systemic changes that can be made, which would improve working conditions for midwives substantially, as we've discussed. But there needs to be commitment at the highest level. It's not just down to individual midwives. At the highest level, government, national and levels, and within, obviously, NHS trusts and health boards and hospitals and birth units, to making this change happen, and in a sustainable way. Thank you.